Now, I have a question for you. If I gave you a patient with chest pain right now, would you immediately think ST elevation, troponin levels, morphine, Mona? Do I even remember what Mona is? Okay. Or would you pause and ask yourself, is this patient stable? Because the NCLEX is not testing whether you can memorize cardiac facts. It's testing whether you can protect perfusion under pressure. So today, um, this is the beginning of the cardiac priority series where we're going to refrain from what you think about cardiac questions so you can stop guessing and start prioritizing like a nurse. So, welcome back to Nurse Ed Scholar. So, let's begin. Okay, here's the truth. The NCLEX doesn't care if you can recite, all types of myocardial infarctions. Okay. If you can name every cardiac medication, all 12 ECG or EKG leads. The NCLEX cares whether you can answer, is the heart perfusing? Is blood reaching the brain? Is blood is the blood pressure stable? Is the patient deteriorating? Because cardiac questions are really perfusion questions. So if perfusion fails, the organs fail. And we're finding that students really have a hard time noticing when a patient is deteriorating. Okay, noticing when there's a problem. So, instead of memorizing cardiac content, you know, we really need to try to train your brain to ask, is the patient stable? What organ system is at risk? What actions prevent deterioration? You know, a safety tip would be, when you're looking at cardiac questions, I'm not going to say always, but they almost always reduce to one thing. And that is really, does this patient have adequate perfusion? All right. So when the NCLEX presents a cardiac patient, your mind, your first mental filter should be, is the patient is stable or unstable? Because unstable looks like hypotension, an altered mental status, chest pain with diaphoresis, decreased urine output because the kidneys aren't being perfused because there's a perfusion issue. New dysrhythmia with symptoms and your MAP below 65. Now, a stable patient would look like normal blood pressure, alert and oriented, no active chest pain, adequate urine output. Because this determines everything, not the diagnosis, not the troponin level, even though that's important, and not the rhythm strip, even though that's important. Stability determines priority, what you're going to look at, or which patient you're going to look at first. You always have those questions, or you will have those questions that say, okay, here are a bunch of patients, and here are their signs and symptoms, maybe even some diagnoses. Which one would you see first? Prioritization, right? So let's look at something real quick. So you have patient A, their heart rate is 110, their blood pressure is 118 over 76. They're having some chest discomfort and they're alert. But then when you look at patient B, their heart rate is 42. Their blood pressure is 78 over 50. They're dizzy. They're confused. Because the NCLEX wants you to be able to notice that B is the one is the problem. Their heart rate is low. They're dizzy. They're confused because the brain is more than likely not being perfused. So even though patient A has chest discomfort, you know, the cardiac priority is about perfusion. All right. So let's talk about chest pain and perfusion. Okay. You know, Many students panic. They're thinking Mona, patient has chest pain. Mona. So that's morphine, oxygen, nitroglycerin, and an aspirin. But the NCLEX really wants you to think deeper than that. You know, instead, the NCLEX wants to know, is the oxygenation adequate? Is blood pressure stable? Are there signs of shock? Is there evidence of ischemia? So, for example, if a patient has chest pain, their blood pressure is 82 over 48, and they have cool and clammy skin. The problem isn't pain. You're thinking pain, 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 but there is a perfusion issue. There's poor perfusion. That's indicated by the low blood pressure, 82 over 48, and the cool and clammy skin. So if you're thinking pain and you give that patient some morphine, because you're thinking Mona, you're giving that patient morphine without addressing that hypotension, you have made that person worse. You have worsened that shock that they are in. And you definitely do not want to do that. You know, when you're looking at patients, you want to think pain, 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 pain. But treating pain before evaluating perfusion is a problem. You want to protect perfusion. So I know, even students, and I know this is kind of off topic, but students want to try to teach a patient in pain. You can't teach anybody if they're hurting. So with this case, you have a patient who's having chest pain. Yes, you want to make them feel better. But if their blood pressure is already low, their heart rate is already low, you giving them that morphine, you're going to do some damage on your patient. So yes, you're like, oh, I want pain, but is there something greater? And that is what the NCLEX wants you to recognize. So when you're looking at chest pain and if is there a certain framework, this is what we try to teach you in school. You're going to assess airway, breathing, and circulation, those ABCs. You're going to obtain vital signs. You're going to evaluate the perfusion indicators. Is the heart rate fine? Is the blood pressure fine? Is the urine output fine? Are they warm to touch? You want to look and see if perfusion is going well in your patient. You want to monitor that ECG. You want to see what that rhythm looks like. And if there's anything unstable, you're going to notify your provider. You always want to make sure that your patient is stable before you medicate, before you treat the pain. All right. So think of the heart as a pump because it is a pump, right? So, because if the pump fails, the blood doesn't reach the organs. Okay. So if it doesn't reach the brain, you're confused. If it doesn't reach the kidneys, you got a low urine output. And if sorry, if the skin becomes cool, you know that your patient is not perfusing. So when you're answering cardiac questions, you want to ask, is the pump effective? Is the heart pumping like it should? Is the blood pressure adequate? Is it high enough to perfuse all of your organs? And is the oxygen delivery intact? You're going to, assess that by mental status. Maybe do a mental status exam. You're going to check it with that pulse ox. And this is going to apply to all the things in the series: acute coronary syndrome, heart failure, dysrhythmias, shock. They are all perfusion problems, and that is what we're going to do in this series. Now, a little mini case. So you have patient A. Patient A has shortness of breath, freckles, blood pressure 170 over 90, and they have some edema. So when you look at this and you look at the patient's symptoms, you should recognize that the patient is fluid overloaded, right? And they have an elevated pressure. Now, you have another patient who is also short of breath, but their blood pressure is 80 over 40. They have cool extremities. So they're similar because they both have shortness of breath, but they're different because one has a perfusion problem. Well, they have different perfusion problems, okay? And that changes the interventions. I always tell my students, once you know the problem, the interventions will be the same. So you just have to realize that that person with the low blood pressure and the cool extremities are possibly going into shock, and that's the patient that you need to assess and to perform interventions on. So NCLEX. So how are the NCLEX questions, structured? So most cardiac NCLEX questions, they have a vital sign. They have some labs, maybe a troponin, a BNP, potassium. So troponin lets you know if there's any kind of heart injury. A BNP lets you know if the person has congestive heart failure. And a potassium, are we going to have an arrhythmia problem, right? There's an order by the provider, a symptom of some type. And then we always talk about trends. You're looking at trends. And when you're looking at the answer choices, they're going to be administer medications, call for a rapid response, continue monitoring, provide teaching. Because the correct question, or the correct answer, I'm sorry, the correct answer will be the action that protects perfusion. Okay. So, before choosing that question, you want to ask yourself 4 questions looking at the scenario that they give you on an exam. Is the patient perfusing? So you're looking at, vital signs. You're looking at their skin. Is the patient stable? Could whatever the answer is, or if you're in the clinical setting, could this order, whatever it is a medication or whatever, cause harm to your patient? And what prevents organ failure? And those are the things that you need to ask yourself when you're assessing your patients and also on an exam. You know, is this scenario, what is it asking you to do? And you're looking for the answer choice that is going to cause the least amount of harm. And that's why we go back to that Mona question. When a person has chest pain and even on a test question, the first thing you're going to say is, "Oh, I need to give them some morphine." But if they're not perfusing, morphine will cause harm. And so that's why you have to start asking yourself these questions. Okay. So, like I said, we're going to be doing the cardiac priority series. We're going to cover acute coronary syndrome, so you don't have to have memorization overload. We're going to do heart failure patterns and fluid priorities, dysrhythmias, hemodynamics. I'm going to try to make that, practical. And we're going to have at the end, as I've done before, and I will continue to do some NCLEX-style cardiac scenarios. You know, we're not going to go over 40 rhythm strips. I want to try to teach you how to think. Okay. So hopefully the beginning and the reframing your mind of cardiac questions. I hope this is going to help you. If so, please like the video. Please subscribe to Nurse Ed Scholar. Turn on those notifications so you'll know when the next video is coming out. I try to do them on Monday and Wednesday. And please go to NurseEdScholar.com. I'm creating workbook resources for you to study better. And so you can, practice perfusion framework. I had some critical a judgment workbook, so it can kind of give you a guide to help you study smarter so you can test like a pro. So can't wait to see you in lesson 2. And until then, happy studying from Nurse Ed Scholar.